Okay guys, this is Caesar again with Nursing School Made Easy, and this is the second part of our lecture on calcium. So now we will focus on hypocalcemia. So what are some causes of hypocalcemia? Number one, decreased parathyroid hormone production. Now, something that may cause this is surgical removal of the parathyroid gland, or in most cases, the thyroid gland. So again, either the thyroid gland or the parathyroid gland is removed. 2. Acute pancreatitis. 3. Blood transfusions. 4. Alkalosis. 5. Decreased calcium intake. 6. Laxative use. Okay. So again, number one, the decrease in parathyroid hormone, either due to surgery of the thyroid gland or the parathyroid gland. Acute pancreatitis. So if you have somebody with pancreatitis, either due to alcoholism or some other reason for the pancreatitis, or the other something else could be something like a gallstone, causing an occlusion of the common bile duct, then you would end up with something like pancreatitis. So again, in that patient, you would want to make sure that you check the calcium levels. If your patient is getting blood transfusions, if they had surgery, some type of hip surgery, they lost some blood, you're giving 2, 3, 4 units of blood. One thing that you again want to monitor is calcium. If the pH is off, they have some type of respiratory disorder, maybe some COPD, some emphysema, it's going to change their pH. Again, you would check calcium levels. If it's a geriatric patient that uses laxatives frequently, or if maybe somebody with some type of history of having multiple obstructions, problems with having bowel movements, then again, you'd want to check their calcium levels. Now, side note, one thing you must remember, hypocalcemia causes increased nerve excitability and sustained muscle contraction. Again, I'll repeat that. Hypocalcemia causes increased nerve excitability and sustained muscle contraction. This is known as tetany. Know this. Now, what are some signs and symptoms that your patient may show? Number one, Trousseau sign. Now this will be some type of carpal spasm that is induced by inflating a cuff, a blood pressure cuff that is, on the patient's arm. Number two, now I can't pronounce this, so I will just write it out. If you can pronounce it, please let me know. Now, this is contraction of facial muscles in response to a tap over the facial nerve in front of the ear. Make sure you know both of these for your NCLEX exam. it will most likely be on there. Number 3, laryngeal stridor. 4, dysphagia. 5, numbness and tingling. In either the mouth or the extremities. Number 6, hyperreflexia or muscle cramps. Now again, this is due to the increased nerve excitability, and again due to the sustained muscle contractions. If you have sustained muscle contractions, you'll most likely end up with muscle cramps. Okay. Now, some interventions. You are, of course, or this lecture is, of course, on hypocalcemia or decreased calcium. Therefore, you would want to give either oral or IV calcium supplements. If you're giving IV, you would give something like calcium gluconate. If you're giving PO, you'd give something like calcium carbonate. Number 2, you would give vitamin D along with your calcium supplement.